Hey guys, I'm Nurse Alyssa, a wound care specialist dedicated to helping you understand and manage all things wound related. In today's video, we're taking a look at one of the most versatile, user-friendly dressings that you can use at home. The silicone foam dressing, created for gentle, reliable, and effective wound care. If you or someone you care for needs a dressing that absorbs drainage, protects fragile skin, and is painless to remove, this video will walk you through everything you need to know. What is a silicone foam dressing? A silicone foam dressing is an advanced wound dressing made with a 5-layer self-adherent foam pad. They combined a soft absorbent foam core, a gentle medical grade silicone adhesive border, and a breathable polyurethane film backing. So here's a close-up. You can actually see the foam core here, and this is the silicone border. And that thin, shiny layer on top is the breathable film. They're designed to absorb moderate to heavy amounts of drainage, protect fragile or sensitive skin, maintaining a balanced, moist healing environment, minimizing trauma and pain during removal. What makes this brand stand out from other silicone dressings? So let me show you what it actually looks like. This is the box it comes in. You do get 10 individually packaged sterile dressings. This is the actual silicone foam dressing. You can see the foam pad right here in the center and the silicone adhesive border around the outside. Each dressing also has clear step-by-step application instructions printed right here on the wrapper. So this is it outside of the package. When you peel back the release film, you can see the silicone border up close here. It has that soft, slightly tacky feeling, but it is gentle enough for sensitive skin. This is what helps minimize pain and skin trauma during removal. The foam layer is nice and thick, so you can absorb quite a lot of drainage into this. So it's about, I'd say, a moderate amount of drainage, but it still protects the wound environment. The dressing is flexible, so it conforms really well to curved areas like arms, legs, and hips, or really anywhere that the skin is delicate. This type of dressing is designed with patient comfort and wound protection in mind. It has medical grade soft silicone to reduce pain and prevent skin stripping, high absorption foam core that can hold up to 15 times its weight in fluid, a breathable polyurethane film backing that allows moisture to escape but keeps contaminants out, water-resistant outer layer, which protects during light showering. Just remember, they're shower-proof and not meant for full submersion. It also stays in place and molds easily to the body's natural curves. How silicone foam works. When applied to the wound, the foam core absorbs and locks in drainage, converting it into a gel. The silicone layer grips the surrounding skin, preventing irritation. The moist environment supports tissue repair and reduces discomfort. The breathable back film helps prevent contamination while allowing vapor exchange. This combination results in less maceration, fewer dressing changes, reduces pain during removal, and a cleaner wound bed. Silicone foam is especially helpful for fragile or elderly skin, patients sensitive to tape, and wounds that produce a moderate to heavy amount of drainage. How to apply and remove a foam dressing. First, collect all the supplies. So you're going to need gloves, saline or wound cleanser, gauze, your silicone foam dressing, and a waste bag. Start by washing your hands and gathering all your supplies and putting on your gloves. Next, clean the wound with saline or cleanser. Pat the peri-wound dry, but avoid drying the wound bed. Next, you're going to choose a dressing that extends past the wound about 1 inch. So this pad that you can see here, you want that pad to go past the wound about 1 inch. You don't really want to be cutting these because it can reduce function of the dressing. So you want one that fits appropriately. These do come in many different sizes. Then next you're going to apply the dressing by peeling off the protective backing and center it directly over the wound and soothe the edges around the outside. Just make sure that you're not actually stretching the dressing as you're applying it. And I will show you here, I'm just going to put it on my own arm. I don't have a wound, but I just want you to see how this is applied. So it does have the two peel back layers here. So what you're going to do is you're going to remove one. Okay. And you're going to apply that. Now, obviously, you're going to be wearing your gloves and you've already cleaned the area, but I'm just showing you quick here, just nice and easy. And then, so the other half is still on, and this is what keeps it sterile. So you don't want to be touching the inside of the dressing. So you remove one half and apply it, and then you remove this other one while it's on. So you just slightly pull back and it applies it really nice for you. Okay. And then you just push down the edges here so it has good adherence. And that's what the dressing looks like. It moves very nice. It doesn't feel like I have anything on my arm. It has the nice thick pad here to protect the wound, but it feels very, very comfortable on. I absolutely love these dressings because it just conforms to the skin. They stay on for 3 to 7 days, which is a really good length of time. When you're not continuously messing with the wound, that's what allows it to heal. So the longer you can leave it on, as long as you don't have an infection, it is better. I always suggest 3 to 4 days to leave a dressing on, as long as the dressing is controlling the amount of exudate coming out of the wound. And then to simply remove this, you just start peeling at the edge here. So it sticks so great, but it also comes off so nicely, and it doesn't hurt. Like, I have hair on my arms. It doesn't hurt like a Band-Aid would. So you just start peeling it back nice and gently, and it just comes off very, very easy. Now, if you are having any pain, you can always, when it's on there, and you start peeling it back, you can add a little bit of saline here, and it lets it release very nicely and not be so sticky. But this isn't a real sticky bandage. It sticks well to your skin, but the removal, it doesn't hurt. Ideal wound types. Silicone foam dressings are commonly used for pressure injuries, so stage 2 or a shallow stage 3 with a low to moderate amount of drainage. Surgical incisions, skin tears, minor burns, abrasions and lacerations, donor sites, superficial non-infected diabetic foot wounds, venous leg ulcers with low to moderate amount of drainage, and fragile skin. This dressing is not meant for dry wounds, black necrotic tissue, tunneling wounds, extremely heavy drainage wounds, and third-degree burns. Now let's go over some common patient questions. Why does the wound dressing sometimes not stick well to the skin? This is often caused by slight moisture or oil on the skin surface. Please ensure that the area is completely dry before applying, and avoid using any ointments or lotions underneath this dressing. Is the dressing too sticky, or will it damage my wound? Although the white foam may feel tacky to touch, it uses a gentle silicone adhesive designed for a pain-free removal. It protects fragile skin and won't cause trauma when peeled off properly. Can I trim the dressing? You want to avoid cutting silicone bordered dressings, as it can reduce the function of the dressing. Can I use the dressing on joints or areas that move a lot? The dressing does work best on flat or low movement areas. For elbows, knees, or high flex zones, additional tape or a wrap may help improve the fixation. Caution: if you have any irritation, you do want to stop using this dressing. Thank you so much for watching. I hope this video helps you understand how silicone foam dressings work and how to apply them safely and effectively. If you'd like to try this product that I showed you here, check out the link in the description, and don't forget to like and subscribe.